Postpartum care is critical for new moms and their babies. It can be a scary and confusing time with so many questions. Some good news this morning: Michigan moms now have access to expanded postpartum coverage through Medicaid with virtual lactation services. Amanda Minimi is with Aeroflow Health. She's here to share more. Good morning, Amanda.
Good morning.
Let's talk about this program. You're actually in North Carolina, but this is available to moms here in Michigan. Let's talk about what's being offered here.
Yeah, so we're really excited to be partnering with Michigan Medicaid to expand our program to the Medicaid population. Aeroflow Health has serviced over 40% of all U.S. births. We know that 37% of the births on the Medicaid program in Michigan happen in Michigan's Medicaid program, so excited to extend that benefit to them. We've been able to offer breast pumps and lactation support to Michigan Medicaid moms now and are thrilled about the opportunity.
Wonderful. So let's talk about how a mom knows she might be eligible for these services through Medicaid. What do they need to know?
Great question. So insurance is definitely very complicated, so we've built out a streamlined process for them to determine what their eligibility might look like. They can go to aeroflowbreastpumps.com. They can enter in their insurance information, and we actually verify their eligibility and benefits instantly on our platform. We offer these services in the prenatal period. I know you mentioned the postpartum period is incredibly challenging. And so what we really want to do is make sure that moms are set up for success starting in the prenatal period. So we have lactation classes. They're offered by our doula providers as well, so they have additional support persons. Our providers are also certified in perinatal mental health, so truly offering a variety of services to those patients.
And I love that you brought that up, that this is something that moms should be doing before they have the baby, because you have that time. You're trying to do everything you can to be educated, to prepare, to be ready for when that baby comes. Let's talk about then, you have all the preparation. Perhaps you have the breast pump, you're ready to go. But, after you have that baby, a lot of moms feel overwhelmed. There are, lots of anxiety. Talk about what these services do for those moms and how having a lactation consultant at your reach can help you in this process.
Yeah, great question. I think it really does start in the prenatal period. I think we take for granted just how complicated things get right after birth. Oftentimes, the only time you're talking to a lactation provider is when you're in the hospital and they're coming in to help you. And then you go home and you don't have enough support. So when you start in the prenatal period, you really get to build a foundation. You get to boost your confidence score. So they're covering topics not just about breastfeeding, but talking about nutrition, birth and prenatal planning, baby care, mental health. And then even in the mental health space, I think it's just being able to understand that your body's going to go through changes, your relationship's going to go through changes, and teaching people different coping mechanisms. In addition to that, we're also building a community around them. So we have the Pumping Room on Facebook as an example. That's 40,000 moms strong, and they're all sharing feedback. So we have our professionals that go in, we have people that ask questions, and they're helping guide the conversations to make sure that people know that they're not isolated, they're not alone, and that some of their experiences are normal or some of them may require additional feedback. But ultimately, we are here to be the advocate for mom and make sure that she feels like she's got the confidence to advocate for herself and her journey.
I love that. I love that so much. So many services that you guys are providing. And, virtually, sometimes people are like, oh, I want to see someone in person. But, man, when you just have a brand new baby, it's hard to get out of the house and get to somewhere. Let's talk about the access and how easy it is when you can be doing this virtually and how big this community can grow because of that.
Yeah, that is a great question. I think one of the biggest challenges is exactly what you mentioned. You have a new baby in hand and you're bringing along car seats, strollers, you have transportation. It gets really complicated, especially when you're bringing along a little one. So to be able to access those classes that we have from 8 a.m. to 8 p.m. Virtually is a lifesaver for a lot of our moms. I think it's hugely beneficial to be able to just tap into the resources when you need them. I can't stress enough that just prenatal classes are critical, but we also have those one-on-one appointments available for those moms that may need additional support. So just being able to hear the questions that others may ask, I think can sometimes ease some of the nerves. Like you can kind of benefit from the questions that others have asked and really be able to share insights with each other.
I love that. All right, Amanda, if people or moms are out there interested, they want to learn more, what do they need to do?
Yeah, if you go to aeroflowbreastpumps.com, you can go ahead and select and enter in for a breast pump through your insurance. And then we also have our lactation classes through our insurance. So there's a nice little qualify form. You can submit your information and we do the rest.
Couldn't be easier. All right, well, thanks so much. There you go, free postpartum and prenatal care. Let's get that straight for moms, plus those lactation services. Breast pumps available, breastfeeding support, aeroflowhealth.com to find out if you're eligible. We'll be right back.